It was once one of the most common causes for hospital admission before the coronavirus outbreak. I spoke with Dr. Michael Liston, cardiologist and chief medical officer for St. Mary's Medical Center, on how to recognize the signs of heart failure and treatments available. How do you specifically define heart failure in your practice?
Excellent question. Heart failure is a very broad topic, and in its simplest form, heart failure is simply defined as the heart's pumping function failing to meet the demands of the body. That being said, there are a lot of different things that go into the heart functioning properly. In the old days, we used to think of the heart as just a pump, and so we would look at the heart, and if it didn't pump enough blood with each beat, we considered that heart failure. As time's gone on and we've looked further into the pathophysiology of heart failure, we've discovered that there's also a filling component. So for any pump to function normally, it has to be able to fill with blood appropriately to then pump the blood. So we have two or more types of heart failure now based on those mechanics. The pumping function of the heart is called systole, and so we used to talk about systolic heart failure. And the filling part of the heart function is called diastole. And more recently, we've discovered quite a bit about diastolic heart failure.
What would you say are the most common causes of the heart failure?
So in the United States of America, our probably most common cause is heart failure due to coronary artery disease. That being said, with the new interest in diastolic heart failure, we're seeing quite a few other issues that come into play: hypertension, diabetes, cardiac arrhythmias, valvular heart disease. So there's many different parts or mechanics of the pump that can fail that can then lead to the definition of heart failure. And I would like to pause just for a second and say I've never been a big fan of the term heart failure, because when I tell that to a patient, they're thinking this is the heart, a vital organ in my chest, failing, which is a bad word to put with the heart. So I think when it comes to heart failure, when you tell a patient that, sometimes that's the last thing they hear. And so what I see as so important in this is education. We need people to know, why did they have heart failure? What are the causes that they can treat, and then go on and live a healthier lifestyle.
What are some of the symptoms that people can look for in regards to heart failure? I mean, how would I know if, I were experiencing, those symptoms of heart failure?
So some of the more common symptoms would be shortness of breath with activity. So if, for instance, you're walking up a flight of stairs and you notice, I'm a lot more short of breath than I used to be, and it's taking me longer to recover, that could be a sign. Another symptom that I like to talk to my patients about is something called orthopnea, which basically just means you're getting short of breath when you lay down to go to bed at night. And oftentimes patients will relate to you, yeah, I lay down, but then a few seconds later I have to get up because I'm gasping for air. Those symptoms typically come on as your heart failure has progressed somewhat. There can be other symptoms such as just general fatigue that can suggest heart failure, lightheadedness, dizziness, passing out. And then there are symptoms of volume overload, where your legs might be swollen or your abdomen might be swollen. So heart failure has a lot of different symptoms. So I ask people to become familiar with the disease heart failure and some of its findings, and then after their diagnosis, to pay attention to those symptoms and relate those to me as a physician so I know how better to treat them.
Well, you can get answers for your questions straight from Dr. Liston on May 20th. The lecture starts at 6:30 p.m. The location is St. Mary's Medical Center Education Center in Blue Springs. For more information, please call 816-228-5900 or go online to stmaryskc.com.